Hello, I'm Dr. Park Minsu. Thank you for always subscribing to my channel. Today, I'm going to talk about how fatty liver is a warning sign to our body when it turns into fatty hepatitis. Fatty liver disease itself is becoming an important health issue. The disease rate is increasing. So there's even a concept of fatty liver disease syndrome. In the past, alcohol fatty liver was a big problem, but now, non-alcohol fatty liver is a major health issue. If you have a fatty liver, if your liver's opt is over 40, or if you see fatty liver on your ultrasound, it's defined as fatty liver. But even if fatty liver is regulated, it varies depending on the person. So it's important to find out if it's a dangerous hepatitis or not. It's very important to try to get rid of fatty liver as soon as possible because it's normal in the beginning. If left untreated, the risk of hepatitis or cirrhosis is very high. Fatty liver has over 5% fat in its liver. The percentage of non-alcoholic fatty liver disease in Korea is around 25. 1 in 4 adults has fatty liver disease. 10% of fatty liver patients have fatty hepatitis. It causes inflammation of the liver and destroys the liver cells. Especially in non-alcoholic fatty liver, excess calories are stored in the liver as fat. I always emphasize that. If you eat an excessive amount of carbohydrates, these are stored as glycogen, and the excess calories are converted to fat. When fat cells multiply in your body, they release glassy fatty acids into your blood. They're released. When this accumulates in your liver, you can get fatty liver. According to the American Journal of Liver Disease in 2016, the mortality rate of liver disease in non-alcoholic fatty liver patients is about 1.94 times higher than 1.5 times the mortality rate of all liver diseases, but if it turns into non-alcoholic fatty liver disease, the mortality rate of liver disease will be 64.6 times higher and 2.56 times higher. So it's very important to know if fatty liver disease is spreading to fatty hepatitis. But the problem is, fatty liver disease and fatty hepatitis don't show symptoms. This is the medical regulation for fatty hepatitis. The liver has a lot of fat, and it's fatty liver. If there's inflammation or damage to the liver cells, this is the regulation, and hepatic fibrosis, which hardens the liver cells, it can be seen as fatty hepatitis. But with fatty hepatitis, we need to see inflammation in our tissues. So we need to do a hepatic test, so not everyone can do it blindly. If the fatty liver is showing symptoms, even though it's not symptomatic, the fatty liver itself has been converted to fatty hepatitis, which is a dangerous condition that can increase the risk of liver cirrhosis and liver cancer. In the case of alcohol fatty liver, if you test positive for fatty liver while drinking too much, you can say it's alcohol fatty liver. If it's alcoholic fatty liver, you should suspect that it's spreading to fatty hepatitis. First, you have a hot flush. Your liver cells are breaking down. Since it's inflammation, your body will feel warm. Due to the destruction of the liver cells, the body can't filter out a lot of waste. So nausea and vomiting can occur due to poor digestion. If it gets worse, jaundiced liver cells destroy the liver cells, causing bilirubin to come out of the blood, causing jaundice. Non-alcoholic fatty liver has been a problem lately. The chances of non-alcoholic fatty liver becoming fatty liver are higher if it's accompanied by hypertension, diabetes, and obesity. So, if an obese person has fatty liver and high blood pressure and diabetes and hyperlipidemia, it's very important to try to get rid of fatty liver quickly. If you have the following symptoms, your non-alcohol fatty liver can go to non-alcohol fatty hepatitis and cause problems later on. Due to the inflammation of the liver, due to the lack of metabolism in the body, you can feel debilitated and fatigued. We don't recover from our exhaustion, and we feel drained. And because you don't absorb nutrients well, you can feel that you're slowly losing weight. Our liver not only cleanses the body, but it also plays a very important role in the body's digestive system. When the liver gets bad, it affects the pancreas and gallbladder nearby, as well as the gastric duodenum. That's why your appetite decreases. One of the biggest reasons for decreasing appetite is because the liver can't filter out waste and toxins. It's similar to how our body becomes septic and overflowing with waste. Naturally, as the liver cells fail to filter out waste, due to bilirubin's elevated levels, jaundice, which makes your eyes blurry and cloudy, your body gets inflamed and overflows with waste. Your skin becomes dry. Dry skin can be a symptom of fatty liver turning into fatty hepatitis. Most importantly, from fatty liver to fatty hepatitis, your liver becomes hard. Because of this, the blood flow to the liver is impaired. Swelling occurs in the lower extremities, especially in the legs. In severe cases, the swelling reaches the abdomen. If there's swelling in the abdomen, fatty liver disease may be spreading to fatty hepatitis. Alcohol-fatty liver is most important not to drink. It's very important not to drink too much. In order to regenerate the liver cells that were destroyed by drinking too much, you need to be careful about eating proteins that regenerate the liver, and antioxidant vegetables that cleans the liver. This is the same concept applied to non-alcoholic fats. When you combine vegetables and protein to help your liver regenerate and get rid of toxins, your liver regenerates well and cleans out waste. For non-alcoholic liver, fatty liver, it's important to eliminate the cause. The most important thing is to get rid of the fat stuck in your liver. So I think antioxidant nutrients, plant-based nutrients, and phytochemicals will help your liver. Vitamins A, C, E, selenium, iron, and other antioxidants like glutathione. As I mentioned earlier, fatty acids from visceral fat build up in the liver, so you need to reduce visceral fat. Exercise and nutrition to lose weight. Eating backwards, vegetables, protein, and carbohydrates in the order that I've always emphasized. Reduce your portion size by 10% and always exercise in your daily life. Walk in place and do 300 push-ups. Exercise in your daily life. Try to walk at least 7,000 steps a day. And because one of the most important factors that increases the risk of non-alcoholic fatty liver getting into fatty hepatitis was hypertension, diabetes, and hyperlipidemia, it's very important to prevent hypertension, diabetes, and hyperlipidemia from getting worse. The liver doesn't send us a lot of signals. If your liver is already sending out signals, that means your liver is in a critical condition. If the fatty liver that I talked about today leads to fatty hepatitis, look at the symptoms, and if these symptoms are happening inside your body, you need to work hard to save your liver. I hope you're a subscriber who knows how to take care of your liver function. And that's it for today's session.